We'll stay with the story and speak now to the Northwest Health spokesperson, Lucas Mothibedi, who is part of the team that is trying to arrange for the bodies in preparation for them to be taken to mortuaries and indeed the repatriation of those that do not belong to South Africa. Mr. Mothibedi, good evening to you and thank you very much for your time. Can you tell us why there are so many pathology vans lined up there? Are you able to paint a picture of what happens when the bodies are brought to the surface? Where are they kept? And are the vans that are there right now standing in wait to transport these bodies?
Thanks so much, Toli, and thank you so much to your viewers. In fact, as you know, that the National Rescue Operation have started. This is day 3. Unfortunately, as we continue to extract some of these mine workers, we are unfortunately faced with the situation of bodies that are lying underground. At least from 4 o'clock this afternoon, we've had about 78 bodies that we've managed to extract from underground. What we have done, Toli, which is the plan of readiness that was shared by the MEC Sololari during his visit yesterday, where he met the Minister of Police, Senzo Mchunu, and the Minister of Minerals and Petroleum, just to allay the fears that were there, particularly as far as our forensic pathology services are concerned. We have identified at least 5 facilities. Your Klegdorp Tsepong Hospital, which is the biggest in the province, with a capacity of over 100 capacity for fridges, in fact. So what we have done is to identify 7 hospitals that will then receive all these bodies for purposes of postmortems and identification through DNA processes and other medical means. That is exactly what we have done. The misinformation and disinformation that was peddled on the ground, it's really unfortunate at this stage because it is trying to put away the strides that we've made as government, particularly the Northwest Department of Health, in as far as addressing this issue. We can confirm to the members of the public and other stakeholders that as the Northwest Province, we are ready in as far as dealing with this matter. We've identified the Brett's Hospital forensic pathology. We've identified the Phokeng forensic pathology with over 100 spaces. In fact, as we speak now, because the forensic pathology in Phokeng has been under renovations, it's empty, but the fridges are working. So we are going to use them in a worst case scenario. We've got contingency plan to deal with this matter decisively by using other, at least 7 forensic pathology services in the province.
Yeah, the state of the bodies, Mr. Mothibedi, are you able to tell us just how long they possibly would have been underground for, particularly because there is a constant reference to the stench on the outside?
In fact, because of the stench we have beefed up our team. We have contracted nurses, doctors, and radiographers and other specialists to assist us in determining not only the cause of death, because as alleged now, it's hunger. Others, we suspect that they may have been killed. That is what we are looking for. We are verifying whether they were killed as a result of injuries or blunt forces or any other means. That is what we are checking. What we have done, Pauli, as the department, we've sent a team of doctors and specialists on site where not only they will determine how long bodies were there, well, that is something that they've been doing now, but they will also ensure that we determine the cause of death. We, unfortunately, because of the number that is trickling in and continues as the day grows, we are only able to quantify and understand the picture as is, what could have led to the death and how long they've been there underground, those bodies.
Very quickly, sir, who then becomes responsible for repatriation processes?
Well, it depends. We are working hand in glove with the Mozambican embassies, Lesotho embassies, and Zimbabwean embassies. I'm not sure if you are asking on the side of costs or you mean the processes, but as is, we as government have committed that we'll work together with our counterparts to ensure that we are able to repatriate them. As is, the law give us an impetus to understand how this process will then unfold. It will unfold in 2 ways. One, we are communicating with the embassies to ensure that they identify the families of those that we've already identified through DNA and other medical means. Upon that, the completion of that process will then negotiate with embassies of those countries to then come and repatriate their citizens in South Africa, particularly the Lesotho nationals who are here. If you look at the numbers, it tells you that Mozambicans are high, at least about 97 who we have identified, particularly those we have arrested. But in terms of bodies, we've got about 89 of them, and of that number, at least half are Mozambican nationals. So we're working hand in glove with all the embassies to ensure that we return them home upon the completion of verification and identification processes.
All right. Lucas Mothibedi, the spokesperson of the Northwest Health Department, thank you very much for your time.